So major structures of the heart that you can see on the inside that aren't directly involved with path of blood include both the fossa ovalis. This is the foramen ovalis when you're a baby, because we actually bypass pulmonary circulation completely. Your lungs aren't fully developed, they're full of fluid, and this is one of the reasons why we want babies to cry when they are born. We want to make sure that this hole is closed. If it's not, you have a condition what's called blue baby, because you have deoxygenated blood coming back through this hole that's not supposed to be, so they have to rush you to surgery. So this is your fossa ovale, but as a baby it is called the foramen ovale, which we will specify on the test if we want to ask you that question. Now there are a couple other structures on the heart that you can see. We have papillary muscles, and these are going to hold down these string-like structures we call chordae tendineae that are part of this valve. We'll cover the valves when we cover path of blood, but just for this video we will tell you that this is the right atrioventricular valve or the tricuspid valve. So these are the papillary muscles, and these are chordae tendineae. Now I like to talk about this mnemonic here, and it's also the common name for the chordae tendineae. We call them the heartstrings. So if we ever hear the phrase, someone's tugging at your heartstrings, these are the structures of the heart that is referring to. Note you do also have them on this side. You have 2 papillary muscles on this side, and you have 3 on this side. Hence why this is called the tricuspid and bicuspid valve, and actually that's specific to the cusps of the valves themselves, but it also corresponds to that you have 2 papillary muscles, bicuspid valve, and then 3 papillary muscles, tricuspid valve. These little structures here, they're kind of bar-like. I can't really remember the term in Latin that it means, but essentially these are, we've seen these before. We've seen them in the spongy bone. We call that trabeculae, and so these are like a network of structures that can be found with inside the heart, and we use the word trabeculae just because we also use that word in spongy bone, and it describes these bar-like structures, and so you can feel them really well. So for the layers of the heart, we will primarily test you on the diagram, but note you can definitely see the myocardium and endocardium, and then the pericardium is on the outside layer of the heart. But we'll pretty much use the diagrams, but I did want to note that you can see that right here, and then you can also see that it's thinner on the right side than it is on the left side. And this is because you have to pump blood to the entire body on the left side, whereas the right side we only have to pump to the lungs, so it's a shorter distance. So I think that covers, oh, I have 2 more things I want to cover. The interventricular septum, which is right here. This is inter meaning in between, ventricle referring to the ventricle, so interventricular septum is referring to this, oh, and then septum meaning wall. This is referring to this structure that divides the 2 ventricles from each other. If you want to think septum, I always think of getting like your septum pierced, your nose pierced. That septum in between, that's the same thing. It's a wall that's between. And then on here we've got this and this wall over here. That is going to be your interatrial septum. So inter meaning again in between what? In between the atria, so we call that the interatrial septum. So that covers all the structures inside the heart. Next video we're going to cover path of blood, and then that should be it for this unit.